Last topic is kind of a short one for this week. We're going to talk about some reactions to illness. So, sort of what happens when you find out that you are ill. Sometimes, even when we know there's a problem, we might delay getting professional help. Think about some of the reasons why this might be. Maybe people are misinterpreting and downplaying the significance of their symptoms. Oh, it's fine. It's just a small pain. It will go away. I don't want to, it's nothing to worry about. We see that quite a bit. We also have this idea of we don't want to look silly. So if the problem turns out to be nothing, we don't want to have sounded alarm bells or look like we're being dramatic or overdoing things. A lot of people will report this fear of looking silly if it turns out to be nothing. Along those lines, we see this idea of not wanting to bother their physician. Well, if it's no big deal, it's nothing major. I don't want to, I don't want to be a bother. I don't want to take up time. Literally their job, but okay. People might also show a reluctance to disrupt their plans. Okay, so if you know that there's some sort of major illness going on, it's a little inconvenient, and people might not want to deal with that. Sort of ostrich approach, the head in the sand, the ignorance is bliss, right? If I don't know about it, it can't cause a problem for me. And oftentimes we'll see people waste time on trivial matters before going to the ER. This is kind of related to all of these other points. Something like this actually happened to me a few years ago. I started experiencing a really severe pain in my abdomen. And at first I was like, oh, it'll go away, it'll go away. And then it wasn't. I really felt quite horrible. So, I kind of moved through the process. They said, oh, it's not that bad. It's not that bad, until it got to a point where it was that bad and I couldn't ignore it. Not wanting to look silly, maybe it's nothing. I don't want to go if it's just cramps or just something that's sort of very routine. And we ended up going to urgent care before we went to the ER, and they took one look at me and said, "Go to the ER." So you find yourself sort of wasting time on these smaller things because it doesn't feel like it's something that's worthy of the ER. People have a hard time. This idea of not wanting to bother people. We especially see this among women. Okay, so women, if you remember when we talked about gender stereotypes, women are taught to be nice, to be considerate, to not waste other people's time. So we see this quite a bit from women as well. Now, how we communicate with our health providers is so important. The quality of communication between patients and their health providers can really help to affect their outcomes. Think about when you've had a doctor who you've really connected with, or you felt like listens to you, or you felt comfortable with, you felt like you could really talk to. You're probably going to be much more likely to share with them when something's bothering you than if you have a doctor who feels very dismissive or very patronizing or talks down to you, condescending. So when that relationship is strong and healthy, you're going to feel more comfortable reaching out, asking questions, and seeking help. Again, thinking about conversations of cumulative risk, though, who do you think are the people who are more likely to have access to those supportive doctors? It's probably not the people living in poverty, right? So risk is cumulative. I can't stress that enough. Let's think about some potential barriers to this effective provider-patient communication. Ever have a doctor who just talks in medical jargon? Oh, I had one. It was awful. I had no idea what she was talking about. And she would act very inconvenienced when I would ask her, what does that mean? Right. So that's a big problem. Patients are often evasive, ever not lie, but ever sort of fudge the truth a little bit to a doctor because you don't want to look bad, or you don't want to hear what it might be. You don't want to, you're fearful of what that diagnosis might look like. We also see patients reluctant to challenge doctors' authority. Now, to some extent, that's warranted. They're the doctor. They've gone through all of the training. You're not a doctor. But at the same time, you know your body better than anybody else does. And so if we think about ways to improve that communication, okay, we can prepare questions and concerns before we go to the doctor. We can be accurate and candid in our reply to our doctor's questions. Ask for clarification if we don't understand something. And don't be afraid to voice concerns about the suitability or feasibility of your doctor's recommendations. If they tell you to do something that doesn't fit in your lifestyle, it is okay to say, well, I'm not sure that that makes sense for me. Are there any other options we can discuss? And these sort of things are especially important for many of you, as I know many of you are wanting to go on into the field of nursing and healthcare. So thinking about how you engage with your clients and your patients is going to be really, really important in getting them the best care possible. Now, as many of you aspiring nurses know, patients oftentimes fail to follow medical advice. Oh, why do they do that? Do things like they don't start treatment, they stop it early, they don't engage in the level of treatment that's prescribed, they do too much or too little, they're inconsistent in following those treatment procedures, drives medical professionals bonkers. But let's think about some of the reasons why this might be. We call it non-compliance. That sounds really negative, really punitive, but there's a lot of reasons. Forgetfulness. Okay, we all forget things. We all forget important things, and that could definitely play a role. Lack of social support. So maybe they don't have anybody to remind them, or they don't have anyone to sit with them as they cope with the unpleasant side effects of a given medication. Maybe they don't understand instructions. Maybe there's a language barrier and they didn't understand and didn't have the resources or the ability to ask for help. Maybe the instructions were simply too difficult and they couldn't understand. And again, same thing, they couldn't ask for help. Or going back to the last point, maybe they don't feel comfortable with the physician. Maybe there are challenges there in terms of the relationship between the doctor and the physician. Okay. So again, as all of you aspiring health or mental health, whatever it is, practitioners, I want you to think about some of the things that you can do when you're working with clients. How can we put them at ease? How can we help them to adhere to our medical advice? Not only to adhere, but to understand why it's important. How can we bridge the gap and help them to understand what the value of treatment is and why it's important? These are all important things to think about. Again, obviously, we can't do a think, pair, share, but think about what you might do when you prepare to visit a medical professional. Think about the way you might feel, your concerns, whether or not you ask questions. Do you feel embarrassed by a lack of knowledge? And then put yourself in the perspective of the practitioner, which you will be one day, and think about how you can channel those feelings that you had into making the experience more comfortable for your patient. So I told you that would be a short one. This sort of wraps up our lecture and our week on stress, health, and coping. What I hope you've taken away is that stress is unpleasant, but it's necessary, and there can be some good sides to it. Okay, so it can have those adaptive pieces. And I hope that you will focus on your own coping mechanisms and think about what you do when you're stressed and how you might engage in coping mechanisms like leaning on social support or indulging in moderation, healthy ways to adapt and cope when you experience stress. That's all, everyone. I'll see you later.